Okay, welcome to this week's Public Health Q&A. Today I've got Stephen Pintus, our Director of Public Health, with us. So it's been a few weeks since we did one of these. Lots of change, lots of things have changed. The roadmap is progressing. Do you want to talk a bit about where we are now in North East Lincolnshire, how we're doing?
Yeah, sure. Things are looking really positive, and I think the rates have come down, and the now seeing our positivity rate, the number of positive cases, is now well below 5%, which is really encouraging. We're still seeing over 100 cases a week, so we're nowhere near where we were last summer. But we're getting better. But there is still this sort of enduring number of cases that we're seeing, largely driven by workplaces. But it's improved considerably in the last week or so, and it's all going in the right direction. What's really good news is the impact of the vaccination on illness and death in the over 60s. Has been a dramatic decrease in the number of cases, and that's really positive and should continue. So we're also now we've had the return to schools. We saw a slight bump in numbers, an increase in the school age groups in terms of transmission, but that's steady now, and of course we've got the Easter break, which has helped bring the numbers back down again. So that's all looking very stable, and we'll wait to see what happens when the schools go back after the Easter break. So now we're just all preparing for the next stage in the roadmap, which is the opening up of some venues, the shops, outdoor hospitality, etc., to see what impact that has in terms of transmission. And of course we'll be urging people to follow the rules, and to continue to follow the rules, even if they've had the first dose of their vaccination.
You mentioned about schools. Obviously some of that has been helped by the fact that students and staff have been offered testing, rapid testing. The government announced this week that testing for everyone will be rolled out from Friday. So did you want to talk a little bit about that? What impact do you think that will have, and are you encouraging people to take up that offer?
Yes, it's the last bit of the jigsaw, Rice. This is the so I think we've been testing in terms of critical workers for quite some time, and then we did schools, businesses, and now it's been rolled out to the general public. I think the point to make around testing is that it's really the final bit of the jigsaw. It's not the key element. The key element is people following the guidance, and ensuring that they hands, face, space, and all of that we've been pushing now for all the way through this pandemic. That's the key measure. The testing is really just a bit like the icing on the cake. It's the final reassurance, and it's particularly important because that so many cases can be asymptomatic. So this testing is really about finding those asymptomatic cases and breaking transmission. It doesn't replace the testing that continues for those that are symptomatic, and that's really important. Any signs of any symptoms, people should isolate and get a PCR test. So that continues. The LFD testing, the lateral flow testing that gives you the tests in 30 minutes, is really there now for that assurance that we are finding all of those asymptomatic cases. So rolling it out to the public, I think it's that if people are going into places that they want that reassurance, if they're not in education, business, then this is the final bit of the jigsaw to enable the public to do those tests as well. And it's just making sure that people have that facility. So it will be available at our community collect sites. It will become available from pharmacists in due course. And if people go to the website, they can discover where their local access point is.
You mentioned the vaccine programme. I want to kind of bring up what I think has been in the news a lot recently, the potential side effects of some of the vaccines. I know the government now made an announcement on this yesterday, and the Medicines Authority has now stepped in as well. Did you want to talk a little bit about that?
Yeah, I mean, I think it's really good that the Medicines Authority has come out and with a very clear statement. I think the measure, what we've got to remember is that we've delivered just in North East Lincolnshire, we've delivered tens of thousands of vaccination without, and large numbers of those are the AstraZeneca jab. So we've delivered them with absolutely no evidence locally of the blood clots that have been identified through research both here and overseas. So I think the on balance, what people have to remember is that they're more likely to get clots from actually getting coronavirus than from the vaccine, and the precautionary measure that they've taken is that it's particularly affecting the younger age group, which is why that they're suggesting and recommending that those under 30 do not have AstraZeneca. It is a precautionary measure. The risks remain extremely low in terms of this particular side effect, and it shouldn't stop people, discourage people from continuing with getting the vaccine, and particularly those that are still to have their second dose. It's just remember just the millions of doses that have been delivered safely, that all medicines have side effects, and the risk is extremely low.
The last thing I was going to come on to, which we talked about briefly again at the start, is Monday, the 12th of April. So from Monday, more and more businesses and venues can reopen, which I know that a lot of local businesses will be clamouring for and really looking forward to. So there will be, I suppose, two strands to this really. What is our message to businesses that are reopening, to business owners and their employees? And also, what is our message to members of the public who will inevitably be customers, visitors to those sites?
For both of them, really, first, Royce, is that this is about us progressing along the national roadmap, and we've learned through this pandemic from how we've approached things with previous waves of the pandemic, and hopefully we've learned from these and we're doing things differently, both nationally and locally. So the learning from the previous experience nationally is that we don't rush things and we don't open everything up all at once. So that's the point about taking things step by step and seeing whether it has an impact on transmission. Locally, we've all been here before. The businesses have got that experience, the public have got that experience of how they managed when we opened up after the last surge, and they can remember back the measures that were taken and why they were taken. This time it's really important, and as you said, there is light at the end of the tunnel, and we want to take this step by step. and it's really key that we stick to the guidance. We do follow the guidance. We don't try and jump a step just because we think, oh, people are vaccinated, everyone's safe. We really do have to adhere to the guidance with regarding to the wearing of face masks, the social distancing, the hygiene, making as much fresh air available as possible, getting the air circulating, however large or small that retail facility is, however large or small that community facility is. We must continue to follow the guidance. The other measure I think that businesses can take, going back to the testing point, Royce, is that are they engaged with the testing regime that's in place for businesses, or is there a way that they can utilise the community collect scheme to ensure that they can give the assurance to their customers that their staff have been tested and are coming up as COVID-free. So these are all things that we can do. The more we adhere, the more likely we are to progress to the next stage and even further opening up. What we don't want is any outbreaks and increase in transmission that might delay the next stage of the opening up and the return to normal life.
Absolutely. The important thing there you mentioned about businesses engaging with testing, it's worth pointing out the deadline for businesses to register for free home testing kits for their employees, that's businesses with more than 10 employees, is coming up. So I think that's on the 12th as well, isn't it? So if you are a business with more than 10 employees in North East Lincolnshire, get on gov.uk and sign up on there. It's completely free. And you will be able to get some testing kits for your employees. And then, as you say, that there is facilities on our website, anylinks.gov.uk, for those that have fewer than 10 employees. And indeed for those employees that that maybe their business hasn't booked any tests for them, they can go off and do it themselves. So brilliant. Right, well, I think we've covered everything. The one other thing I did want to say is, and it's again for businesses that are opening up from the 12th, we are hosting a webinar with yourself and other members of public health on Friday, so that's tomorrow at 2:30 p.m. So if you need any more information about that, visit our website, anylinks.gov.uk, and all the information is on there. Right, well, that just leaves me to say thank you, Steve, for your time today, and enjoy your, well, we've got another day to go, but enjoy your weekend.
Thanks, Royce. Take care.